Let's talk about psych definitions. Most students think psychology means talk therapy, or that psychiatry is the only way to work with the mind. But what if there's an entire world in between that no one has really explained to you? Today, I am sitting down with licensed clinical psychologist Dr. Christal Badour, and we are unpacking the full landscape of psychology, from clinical practice and trauma care to research, brain MRIs, and even working behind the scenes to influence policy and insurers so patients can actually access treatment. Listen, if you don't take the time to explore this with us, you might miss the place where you actually belong in medicine. And it might be the perspective you didn't know you were missing. Welcome to Shadow Me Next, a podcast where I take you into and behind the scenes of the medical world to provide you with a deeper understanding of the human side of medicine. I'm Ashley, a physician assistant, medical editor, clinical preceptor, and the creator of Shadow Me Next. I invite you to join me as we take a conversational and personal look into the lives and minds of leaders in medicine. This is Shadow Me Next with Dr. Christal Badour. Dr. Badour, thank you so much for joining us today on Shadow Me Next. It is such a gift to have you and your expertise with us today. And I am thrilled about some of these really challenging concepts that we're going to discuss today. So thanks for joining us.
Oh, thank you so much for having me. I'm excited to be here.
So first question is a little bit of a getting to know you / getting to know the specialty question. And this is really, it's more definition based. There are psychiatrists and there are psychologists and there is clinical practice and there is research and there is everything in between. So could you just orient us a little bit to those things and help us really appreciate where your role is in this very vast world of psych?
Yes, definitely. This is a question I get very frequently from college students who are trying to decide their own career paths because they don't really know the difference. So happy to talk a little bit about it. So I am a clinical psychologist, so I'll talk a little bit about that. But first, let me just make the distinction with what a psychiatrist does. So a psychiatrist goes to medical school, has an MD, and then specializes in the discipline of psychiatry, focusing on understanding how to diagnose and treat mental health disorders. So they do receive a lot of training in medication management of mental health disorders, as well as some training in therapy. Psychologists, on the flip side, we're sort of a rare breed in that we can have either a PhD degree or a PsyD degree. There are a couple of different doctoral level degrees in that space. I personally have a PhD. It's a little bit of an odd degree in that we're trained equally in research and clinical practice. Whereas in psychiatry, many psychiatrists who go on to do research actually do research intensive fellowships afterwards. We're trained all along the way to integrate both. So we can become licensed psychologists and practice full-time or part-time. And what our practice usually looks like as psychologists is very therapy or assessment or both focused. We can also do research. We can also teach. And so it's a pretty versatile degree in that it really allows a combination of a wide variety of different activities.
That is amazing. Thank you for those definitions. And, I think it's interesting because when we say doctor, nowadays we know to ask, well, what kind of doctor are you? And, let's talk about the alphabet soup is what we like to say after your name, right? So then as a PhD, obviously a lot of us go to academics, right? We think about teaching, we think about research, but there is also, obviously there's a big element of clinical practice. And when you say clinical practice, this is speaking directly with patients about their concerns. And you said it's about 50-50 then.
It depends on the training program. If different programs emphasize more research training, more clinical training. But actually, if we look at the job market for PhD level psychologists, the most common profession for someone to have is full-time clinical practice, where they are meeting with patients, working with them, either one-on-one or in group settings. And those settings really vary from private practice, like a one-on-one, or group practice where you might work with other psychologists or mental health professionals. And then we see a lot of PhD psychologists who actually work in hospital settings as well. So it really can kind of run quite the gamut of what people do with their degree.
That's so interesting. So I'm imagining myself as a college student thinking, I want to do something in this realm, in this world. In your opinion, how would I start to kind of different, aside from shadowing amazing people
Mm,
on Shadowing Next? How would I start to differentiate and really start to learn how to find my place? And what happens if I feel like maybe I've taken a misstep and I need to kind of regroup
yeah.
it and shift? What tell us a little bit what that looks like in that field.
Great question. So we really see students whereas students who are planning to go to med school, I think shadowing is a really important part and component of that. For the students who are coming our direction, because we really emphasize both the research and the clinical
Mm.
practice pretty heavily, our admissions process tends to really prioritize students who have a firm grounding in research at the undergraduate level. So we really look for students who are interested in getting exposure to that and helping them to really understand the foundations of scientific psychology, um, because we believe that psychological practice and therapy really needs to be grounded heavily in the science and the evidence, so that we're doing more than just chatting with people. I think that's a misnomer that the general public often thinks. In fact, we're doing a lot of rigorous testing of the best ways and best approaches to treat particular problems. And so we find when students who are interested in going in that path, they really get immersed in that early, it can help them lay the groundwork in important ways for that next step.
Oh, thank you. That is just the perfect definition. I really appreciate that. Scientific psychology, we're both smiling because we both know where this conversation is very soon going to lead us. And that is a conversation about your website and this amazing platform you've created about science for survivors. But we are not going to get there yet because that is actually going to be the cherry on top. But it's so interesting. So this scientific psychology, tell us what research in psychology, what does that look like? What are you investigating? Are there patients involved? Do you have principal investigators, that sort of thing?
We do. And it's really broad. It looks
Mm.
everywhere from people who are interested in more basic understanding at the mechanistic level. We have people working with animals. We have people who are doing more genetic level research or brain function and structure, MRI based research on the more basic side. Much more applied, we see research where we're trying to understand the risk factors that might lead people to develop certain mental health problems. We look at different intervention techniques that can be used to help people once they've actually developed a mental health problem. So, how can we best treat different issues that may emerge? What's going to be more effective? Say, if someone has panic disorder, as an example, what might most help them address their panic symptoms. And we're going to test out some different possibilities to see what's going to benefit the most people. Um, we have research also even looking at, once we have good treatments, how do we get them out there? How do we make sure that clinicians are equipped with the best evidence so that when someone walks into their office, they know I can use this tool. And we also have psychologists who are doing research on how do we then translate that into policy so that we can make sure
Mm.
that insurance reimbursement is covering the best care.
What?
Yeah, I
Wow.
know, I know, crazy concept, right? And then I think a really important part that also happens here is that people are so different that we also really need psychological research that looks at how do we best translate this work for unique populations. It's not a
Mm.
one size fits all. So
Mhm.
we have a lot of cultural psychologists who are thinking about how can we adapt our care approaches so that it best fits everyone who needs care.
I have never been interested in research, and yet the way you just described that, now it sounds so wonderful. It sounds so interesting and so compelling. And I think a lot of people that I've spoken with in the past, and as PAs, we don't really need a heavy background in research, right?
Mhm.
Physician
Yep.
assistants, it's one of the main things that separates us from the medical students and from a lot of other
Mhm.
areas of medicine too. Hence why research scares me. So let's talk to the others. Let's talk to the student who's sitting here thinking, yeah, research scares the living daylights out of me. But what you just described, Dr. Badour, sounds incredible. Yeah, I want to influence policy and I want to influence all of this change. And I want to play with MRIs. That sounds great. What for the student who maybe is now thinking about research?
Yeah.
What kind of qualities do they have to be the smartest person in their class? Do they need a 4.0? What kind of qualities does that student really need to at least take a step in and even see if this water is for them?
Yeah, I would say no. I don't think it has to be the perfect student. I think one of the biggest challenges, and really there is no perfect student. I want to just say that first of all. Um, one of the biggest challenges in getting involved in research is that there's often more students hungry for it than there's space to do it. So one of the biggest challenges is finding someone who's
Mm,
doing research that you're interested in, who might have some openings. So some of it's a little bit of luck, a little bit of timing, but there are often on various campuses, there are whole offices that are dedicated to helping match um, students with researchers in different spaces who might be doing the work that you're interested in. And I think a big piece about research are two things. One is that it can feel really intimidating, like you said, and many
mhm.
students are like, that's not for me. The other is, I think, finding the right match. So when we talk about that whole huge range of different areas in psychology that one could do research, there's probably many of them that are very boring to some people.
Mm, mhm.
And if you're in the wrong lane, then you might think, oh, research isn't for me. Um, so I always encourage students, like, try out as much as you can. This is a great time when you're really exploring what your career options could look like. I know a lot of students get early on, like, I got to get locked into my career path and I need to build all the things so I can stand out from the next person who'll be applying. And I think there's truth to that. I mean, obviously, these are competitive spaces, but I also feel like, what's the point if you get so locked in that you on the outcome that you miss the process and the
Mm.
opportunity to really explore, like, what might excite you and sustain you for your whole career, not just thinking about, like, okay, how do I get into that next step of medical school or PA school or clinical psychology? Like, I think we need to think a little bit more broadly about that.
I'm so glad you said that. I want to stand up and shout that from the rooftops. You're absolutely right. When we are trying to determine what we want to do as undergraduate students in college, and we see our end goal, right? MD, PA, whatever. We see our end goal, we're going to start checking off those boxes. And
Yeah,
and
that's right.
and if you want to reach that end goal, which newsflash is not the end, right? If you
That's
want to
right.
reach
Just a
that
new
and
challenge to
that
start.
next step, yes, if you want to get there, you have got to form what I like to call this professional narrative, right? These
Yes.
things, these boxes that you're checking, they have got to communicate with each other. And you have got to be telling a story with what
Hmm.
you are choosing to focus on. And number one, you're right, it prevents against burnout, it prevents against boredom, it prevents against, well, maybe even a nasty taste in your mouth with research. It's
Hmm.
going to motivate you to stay interested. And if you look at some of the most successful people we have talked to on this podcast, their story starts way back and it seems like it's not connected. And then they
Oh,
drop a
yeah.
line and they say, boom, this is where I decided. And this is where I saw where I'm going to be now,
That's
15,
right.
20 years from now, which is just, it is just amazing. So thank you so much for saying that. As Oh, I feel great. Thank you. That is amazing. Let's shift a little bit because we have talked about so many, the bird's eye view of your specialty. I would like to now start focusing on what you focus on every day,
Hmm.
which is
Yeah.
really trauma, it sounds like, and
Yes.
working with survivors, which I do want to say, you have a really beautiful line on your website talking about the word survivor and
Yeah.
how it doesn't necessarily resonate with everyone and how people describe their experiences in many different ways. Keeping that in mind, maybe tell us a little bit about how you arrived at your specialty and what a day in your life looks like right now.
Sure. So I actually started doing trauma psychology a bit from a personal experience, which I think many of us, that guides our career.
Mhm.
So I was a undergraduate at Tulane University in 2005, which is when Hurricane Katrina hit New
Oh
Orleans.
yeah.
So I was very personally impacted by that, and so was the community that I lived in. And I found I'd always been interested in how people thrive and recover after difficult situations. And then I just knew after that I had an opportunity to work in some schools on some recovery supports for youth who were returning to the city on when they needed some extra support. And I thought, this is what I need to do
Mm.
for my life. And I ended up, because none of our paths are linear, I thought I would work with kids and do disaster based work. But through the nonlinear pathway, I over time started working more with adults, and I do a lot of work with particularly women, but also people of all genders who've experienced sexual violence or other forms of violence. And I found that the more I did that work, the more it really spoke to me. And I think there's just so much more to be done. And I found that the experience of people who have talked about how they've been through these really difficult situations and have then built a full and meaningful life, where that's just a part of their story, right? It's not their whole story. That really has inspired me to take the career path that I have.
Incredible. And I'm so grateful for you, and the care that you provide to these patients is just amazing. And then beyond that, again, like I said, the platform that we're going to talk about is just incredible. So you work with survivors. You mentioned mainly women, or a lot of women, and that's not all though. I mean, you have worked with patients, survivors of violence, of war, of systemic
Yes.
trauma,
Yep.
and all of this because of your national telehealth practice. What has surprised you most about how trauma presents across all of these different populations? We know it's not one size fits all, but really
Yeah.
expand on that for us.
Yeah. Yeah, I mean, it definitely looks different, and people have different experiences depending on the types of trauma that they've been exposed to, and also in a lot of cases, like the support that they've received afterward. I think we don't give that enough credit to think about how people recover after trauma. But I think one of the most surprising things actually are the similarities. You know, I try to do a lot of education about PTSD, which is my post-traumatic stress disorder, which is really kind of my specialty area within this. And when people hear PTSD, they think about war movies. I think that's kind of the most common thing we think about. But actually, some of the earliest research on recovery from PTSD was in sexual assault survivors.
Wow.
And so there are a lot of commonalities. And one of the biggest threads that I think I see running across is people tend to experience a lot of self-blame and guilt and shame. And I see that regardless of the type of trauma that people have experienced. And so one of the biggest things I've done, both in my practice, but also I'm also a professor. And so I also do research, kind of continuing that stream of both, is to try to better understand why is it that people feel responsible for things that have happened to them or been done to them. And what can we do to help them better understand and appreciate that actually what happened to them is not their fault, and that they're not alone in this process, that there are other people who are feeling a similar way.
This is a great time to pause for Quality Questions, a segment on the show where we discuss an interview question that you might hear at your own pre-health interview. The interview question here is this: tell me about a time when you realized that understanding a patient's behavior or emotional experience was just as important as understanding their diagnosis. How did that moment change the way you approach patient care? Think of a moment where you focused only on the clinical task and you missed something human. We don't like to think about this, but it is so important for our clinical development. Write it down and then ask yourself what you would do differently now. And it doesn't just stop at Quality Questions. There are more resources for you as a pre-health student on shadowmenext.com to include our newly released application readiness course. So head on over to courses.shadowmenext.com and check it out. Community, I would imagine, would be so important in this case for patients, but also really, really challenging to find, which is why, having a trusted healthcare provider or clinician on your team is so incredibly important. Let's talk about forensic assessment a little bit, because this is something else that you do. And I think, people hear forensics and they get so excited. Thank you, TV shows.
Yes.
Thank you, all the other forensic podcasts.
Yeah.
We just spoke to a forensic nurse who actually told us a little bit about what forensic nursing looks like. But I would love to hear, in terms of trauma psychology, what forensic assessment means and what that looks like for you, how you get to be involved in that.
Yeah. This has been a real joy that I've come to a little bit later in my career. Some people really train to specialize in forensics. I trained more to specialize in traditional clinical psychology, but I found that it just made a lot of sense with my pathway. So when I talk about forensic psychology, really the distinction here is I'm addressing questions that are relevant to the legal system in some way. So that can be really broad. But in the space that I deal with this is mostly people who have experienced trauma, and the trauma that they've experienced or the reactions to those traumatic experiences uh, complicate or affect their legal cases that they're involved
Mm,
in some way. Um, so one space where this comes in is when people have personal injury claims.
mm,
They've been injured on the job or out in the world somewhere, and whatever has happened to them has led them to develop some trauma-related conditions, maybe depression, maybe PTSD, maybe increased anxiety.
mm,
And an attorney would reach out to someone like me to actually do an assessment to determine whether or not um, they are experiencing psychological difficulties and whether that's likely to have been affected by whatever situation is relevant to the court case. So that's one space. And then also see it for people who are filing for disability claims, for
mm,
example, might be a similar type of process. Sometimes in criminal cases, when someone has been convicted of a crime, there's a separate stage of sentencing to determine what the consequence should be
mm,
for the crime. And sometimes defense attorneys may be looking for a forensic psychologist to meet with their client to do some work called sentencing mitigation, where what we would do is actually assess that person to determine whether traumatic events they've had in their life may have had some impact on the decision making that that person underwent when they engaged in a crime. So that's another space where someone like me might come in. And then another space that I am just starting to do some work in that I'm very excited about is immigration and human rights cases, where there are a number of different spaces in the law to help support people who have experienced violence.
mm,
And this might not just be immigration, this can be for citizens as well. But in many cases, people who are here seeking asylum or who are here potentially undocumented, but they have important information. Like, let's say they live in a community where they've been a witness to a crime.
mm.
Of course, law enforcement would like them to cooperate, but they might be afraid of their immigration status and that might cause complications for them. So there are actually some legal protections in place that can help them to participate in the justice system in unique ways. And so oftentimes a psychologist like me would be brought in to help to assess the person and see if they meet qualifications for that. Like when someone is seeking asylum because they've had to flee their country due to violence or persecution, we might come in to assess and learn a little bit more about their background and see if it really fits those legal definitions to support their case. So really a huge range of different things that a trauma psychologist could be doing in the forensic space that I think has a really important role.
Oh my gosh, yes. And especially nowadays, and we like to keep these episodes evergreen. So I try not to talk about hot topics too much, but especially nowadays, those immigration services that you are providing, that's incredible. I think we all talk about how broken the system is. We don't very often talk about the people who are sitting in the system trying to fix this broken system, which is exactly where you are. And knowing that there are people like you standing right there helping both sides is just incredible. And I'm so grateful for you. I cannot imagine that would be a very easy job. But you know what? Most of what you do is probably not a very easy job.
It's
Which
not, but it's really, really rewarding, I will
yes,
say.
yes, much like how you founded Science for Survivors. I cannot imagine that that was an easy thing. It is just an incredible gift. You are a professor, a clinician. You have legal system and immigration experience. This sets you up so well to help develop accessible guidance for so many people in the world of psychology. We speak in languages that are very, very different from the layperson.
Yeah,
And I would
that's
imagine
right.
that you just have seen how this impacts and affects people
I have.
Tell us about Science for Survivors, and primarily tell us about what gaps in healthcare you saw that
Yeah.
inspired you to create this incredible platform.
Yeah. Thank you. It's, I've been working in this space now for longer than I care to admit. And there's just wonderful research and treatments that have been developed. And the big gaps I was seeing were that the everyday person who needed support in trauma recovery didn't know where to look,
Mm,
couldn't navigate how to find good care, or even there's all kinds of care out there, but it's so difficult to know what do I need, what's going to actually help me, if they can access it at all. um, and I found that that just felt so unsatisfying to be spending so much time on the research and training side in my role as a professor, and feeling like there's this cliff where the work just falls off. And I work a lot in communities. I also serve on a board for our local rape crisis center. So I see a lot of people in
mm,
crisis who are coming in like that first stage of support that they need. And then I just see them. We have a wonderful support system that it's very underfunded. And so I
mm,
see them just running into these barriers after barriers after barriers. And so I thought, well, in all my extra free time, which I don't have, but I'm just going to add it on anyway. Um, I wanted to start something that would allow me to have my hands a little bit more in some of the direct practice, doing
mm,
therapy with survivors, doing forensic assessments. But then also a big component of this, which is I think what you were alluding to there, is public science education.
yes.
So we as scientists do a terrible job of communicating what we do and why people should care about it. We need our own marketers, like we really do. Um, and so I'm not great. I mean, I'm learning this process as I go along too, because I do not have a marketing background, but I have worked for many years in having conversations with people in the community and doing sort of, I try to do like bring science to the bar. We have like a lot of different events like that where people can just come
Wonderful.
in and yeah, it's so fun. And I found I feel really passionate about that. And like
Mm,
conversations like this, where you and I sit down and we talk about, okay, how do we make science accessible and exciting and less intimidating? And so that's really where Science for Survivors started. Is I want to take all this information that I've been so privileged to be able to access because you got to go to college, because I got to go to
mm,
graduate school, because I'm a professor. And I want to use that in a way that makes it so that the everyday person who might be struggling, might have questions, can come and say, what do I do? And how do I know I can trust it? So that's really what Science for Survivors is about at the end of the day.
that's incredible. And it is such a gift. The
Mm.
only way that we are going to help protect trust in our clinicians and the people that are really weaving themselves into our lives and our healthcare is to get into communication with them, to get into conversation with them. And I love the fact that you have made this so easily accessible at scienceforsurvivors.com. It's an incredible gift. It's a great place to start. Take a look. Please share it with your family members and your friends. It just opens the doors to exactly to what you were talking about, to making this a little bit more palatable for the average person, which is so important. As we wrap up here, and on top of all of the incredible things that you have done in your career, you've also given a TEDx talk. And in your TEDx talk, you explored how stigma and science shape trauma care. So,
Mm.
speaking directly to the person who is a future clinician right now,
Mhm.
what is one thing about trauma that you wish we were learning about in our healthcare training?
I think one of the biggest things I see, because I've actually done some training for medical students in how do
Yes.
we address this. And what I've seen is a lot of times I think students feel very intimidated. They want to help, they want to ask about these things, but they don't feel like they have the right tools to ask about trauma. And then if someone says, yes, I'm
Mm,
feeling unsafe, or this has happened to me, I've talked with a lot of people, both students and clinicians in practice, who say, I don't know what to do if they tell me that.
right.
And so I would say, I think and I do think this is something that needs to change overall in our education and training systems, where regardless of our discipline, trauma is so broad and affects
Mm,
so many different parts of our lives. Um, And then I think all medical professionals, regardless of the spaces that we work in, need some level of training so that when these things come up, they feel like they know how to address it in a supportive way. Because that first time that someone discloses that something has happened to them, that's so key for their recovery.
Yeah.
And to know that you can trust a provider is going to respond in a supportive and non-stigmatizing way, it can make all of the difference. And so my hope for trainees is to recognize that it is important to talk about these things. And if you're going to say one thing to a survivor who discloses to you, I would say, and I talk about this in my TED Talk, if you say only one thing, it's that I believe you, and it is not your fault, and there are resources that can help.
Absolutely incredible. Dr. Christal Badour, you are amazing. I am so grateful for you, for what you're doing with scienceforsurvivors.com and the research that you're contributing to this world. Thank you so much. And thanks for joining us today on Shadow Me Next.
Thank you so much, Ashley.
Thank you so very much for listening to this episode of Shadow Me Next. If you liked this episode, or if you think it could be useful for a friend, please subscribe and invite them to join us next Monday. As always, if you have any questions, let me know on Facebook or Instagram. Access you want, stories you need. You're always invited to Shadow Me Next. Please keep in mind that the content of this podcast is intended for informational and entertainment purposes only and should not be considered as professional medical advice. The views and opinions expressed in this podcast are those of the host and guests and do not necessarily reflect the official policy or position of any other agency, organization, employer, or company.